Today's To Your Wellbeing focuses on a really heavy topic, but it's one that we need to continue to talk about because suicide can impact anyone at any age, and we all have a role in playing in preventing. So it starts with awareness and education, which is why for the next 15 minutes, we are going to be discussing the warning signs with Dr. Jenna Mendelsohn, a clinical psychologist at LeBauer Behavioral Medicine with Cone Health. All right, so Dr. Mendelsohn, first and foremost, of course, thank you for sharing your time and your expertise. What kind of warning signs do all of us need to be aware of?
Well, unfortunately, really anybody can commit suicide. There's no clear way to predict. There are some risk factors that we do know. Historically, suicide has been more common among adult males over the age of 65. Unfortunately, that number seems to be moving lower and lower in more recent years, especially since COVID. And suicide is now actually the second leading cause of death among people aged 15 to 24. So really, it can affect anybody of any age. It's found to be more common among males. People who have a history of substance use are at higher risk for completed suicides, as well as mental illness and actually impulsivity. Tragically, suicide is often something a person's been thinking about a while, but actually an impulsive in the moment act to actually go through with it. So impulsivity is associated with completed suicides.
And a lot of people experience depression, which can often lead to that. So how would someone know if it's gotten to that point that their loved one, their family member, their coworker is considering suicide?
Unfortunately, many, maybe most people keep these kinds of thoughts to themselves. So it's often really subtle and really hard to know the signs, especially when you add in the fact that many completed suicides are kind of an in-the-moment decision. That being said, there are some behavioral red flags to look out for. If a person says they want to kill themselves, it's really important to take that seriously. Often people kind of misconstrue that as being attention-seeking, but these kinds of statements are rarely attention-seeking, and it's always important to take them seriously. Sometimes people won't quite come out and say that they are having thoughts of killing themselves, but they do say these more kind of passive things like, well, I won't be a problem much longer, or if anything happens to me, I just want you to know. And they kind of tell you things, or they want to make plans for after they pass away. And often those kind of comments might seem out of the blue. Somebody giving away favorite possessions, making plans for pets, throwing out belongings that you know are important to them, that's a very big red flag. And sometimes when somebody abruptly becomes cheerful after a prolonged period of depression, that can be a red flag for suicidality. It can be that the person has finally kind of committed to the decision to commit suicide, and they're feeling a sense of relief that they won't be suffering for much longer. Or there are some instances where a person maybe does start to feel a little better, but it's just better enough that they have the motivation to act on plans that they may have been having. So kind of abrupt cheerfulness can unfortunately be a red flag. Somebody writing a suicide note can, of course, be a pretty significant red flag. If someone is writing things like that, it's important to take it seriously. And somebody expressing kind of bizarre thoughts about, different conspiracies that are happening and things they fear might happen to them, might be having a kind of a break where they could be at higher risk for suicide.
All right, so there's a whole gamut of different things there to be aware of, and we really do need to be aware. Sometimes we pass by people or have conversations with people, and later we think to ourselves, I wonder if something was going on there and I just wasn't keying into it because I wasn't focused or paying attention, which makes me think about warning signs and if they're different, like for children or teenagers, especially when you were talking about how sometimes it's an impulse thing, and I think of children and teenagers that way. Are there different warning signs that parents need to watch out for?
It's many of the overlapping warning signs, but they manifest differently based on developmental level. Children who are being bullied, if you're aware of bullying that's going on, that can be a predictor for suicidality, having suicidal thoughts. Often children feel like there's no escape, and so they resort to thinking about suicide. Talking about death or dying, drawing or writing stories about death or dying, those can be red flags. Thinking about things happening to their loved ones after they die, that can be a red flag too.
Right. So, and I think to myself, if you saw your kid was writing something like that or drawing those pictures, you'd want to approach them. Is there a certain way? How do you approach them when that happens?
Often, parents are afraid about asking children outright if they've had thoughts about killing themselves. There can be a fear that saying that can give them the idea. And one thing that we know for sure, there's been a lot of research on this, is that directly asking someone if they are having thoughts of taking their own life does not increase the thoughts of it or the risk that they might start thinking of it. So if you are concerned about your child, I would first ask in an open-ended way and kind of see what they say, and they might come out and tell you. But if you're really concerned that your child or adolescent might be having thoughts of suicide, go ahead and ask them. Have they have had thoughts of hurting themselves or even killing themselves?
Okay, we're going to take a quick break here, but we are coming back. We're going to answer more of that, especially like then how do you maybe have that same conversation with an adult? That might be a little bit different. We're going to talk about that and much more when we come back. We're talking suicide awareness and prevention with Dr. Jenna Mendelsohn from Cone Health. So this is one of the things where in our last break we were just talking about how do you have that conversation with the child if you see some of those warning signs. I'm guessing some of the steps will be the same, but some will be a little bit different if you are going toe-to-toe with an adult who you may think are having some of those issues.
Absolutely. So if someone you know or love discloses to you that they're having thoughts of hurting themselves and killing themselves, first thing is take it seriously. We always want to take this seriously. Try to stay calm. Try to, it's easy, it's upsetting to hear that and easy to have our own emotional reactions. But the more you can stay calm and just leave space for them to open up, the more helpful information you're going to get to keep them safe. Don't promise confidentiality because you're going to want to let their friends and family members know about this so that they have that much more support in terms of keeping them safe. Ask them if they have a plan. See if you can find out what the plan is so that you can maybe help in making sure that they don't have the means to act out their plan. If you need to, if you're really concerned that this person is not able to keep themselves safe, take them to the emergency room. Go ahead, call 911 if you need to, drive them to the emergency room, take them to a mental health urgent care. And once they're there, the medical professionals will be able to keep them safe and triage them to the appropriate treatment.
What happens if you're not like in the same area? A lot of times I think to myself, we're having these kinds of conversations with people who are in the same room or in the same town or something like that, but maybe we're towns away. How do we help them?
Keep them on the phone, keep them talking to you. And if you can, it's tricky to keep them on the phone and do this, but call their local police, call 911 if they're in your area, and have the police go out and do a well check on them. And if they're not safe, they will make sure that the person makes it to the emergency room and gets into the appropriate care.
Especially if they're talking to you and saying, I'm going to do this now kind of thing. And All right, so can you share how the Guilford County Behavioral Urgent Care Center can help people? I think a lot of people would be interested, like, if you do take them somewhere, what are the steps? What happens next?
Absolutely. So this is a great resource available to those of us in Guilford County. They're open 24/7. Their phone number is 336-890-2700, and they see people aged 4 and up. So if you have somebody that you're concerned about where you need that care right then in the moment, the Guilford County Behavioral Health Urgent Care is absolutely an option.
All right, say that number for me one more time.
Yeah, absolutely. It's 336-890-2700.
All right, now, since you said that phone number recently, there's a new hotline, the 988 hotline launched. Talk about how that works, who's on the other end of the phone, how they'll be giving help.
So this used to be the Suicide and Crisis Lifeline. It is now, kind of a national emergency line for people having mental health crises. It offers 24/7 phone call, text, and chat access. You get to talk to a trained crisis counselor who can help people experiencing suicidal ideation and also substance abuse and other mental health crises. So if you are in a situation where you're talking to a friend and maybe you're not sure what steps to take and you're really concerned about them, this is a number that you can call and speak with a mental health professional who can help guide you and your friend through whatever they might need next.
And to do it together. Now, that's one resource. I'm sure there are other resources that people can utilize that we can touch on really quickly.
Well, the most simple and straightforward one that I want to make sure people know is if you or someone you know is suicidal, you can always go to the emergency room. They will keep you physically safe. They will figure out what it is that you need, and they will triage you to the appropriate care. So there's a really simple solution if you or someone you love is having suicidal ideation.
We have about a minute left, and I kind of want to, what are the common misconceptions that maybe you want to set straight when it comes to suicide?
Yeah, often people will think that it can't happen to anyone that they know, that it only happens to a certain kind of person, or that it just wouldn't happen to someone like them. And unfortunately, that's just not true. People of all ages, races, genders, cultures commit suicide. Currently, 20% of high school students endorse having some kind of suicidal ideation at some point. I might be misquoting this, but I think the statistic is 30% of people experience these kinds of thoughts at some point in their lifetime. So unfortunately, it's really common.
Okay. Thank you for your time and your expertise. We appreciate that. We don't want you to miss any of what we have talked about in the last two segments. So in a few minutes, we're going to have everything that we just went over, including those phone numbers and things, on our website. Just head over to the To Your Wellbeing section.